It's such a taboo subject, isn't it? Like, cancer is related to death. If you have cancer, you die. But I also thought that as well. When I got told you've got cancer, first thing I thought was going to look after my children.
I'm trying my best to manage it as well as I can, but I'm not going to let it rule my life. I'm not going to give up everything that I find enjoyable in life.
Biggest thing though, and there's lots of people that will know that have had a diagnosis of cancer, is it doesn't just affect the person that gets the diagnosis. It can also be as difficult for the friends and family as well.
Historically, lung cancer, it was a really horrible diagnosis to get, and we found it very difficult to treat patients, and that has changed completely in the last decade.
There is so much support out there for people as well. If you encounter any issues, don't suffer in silence. There's so much support out there to help you come back. I came back to break the world record.
Hello and welcome to Taking Control of Cancer, the podcast from the North East London Cancer Alliance. I'm Steve Bland, and this podcast is a bit like a how-to guide to help you overcome common myths, fears and barriers to cancer prevention, diagnosis, treatment and care. We aim to provide both patients and healthcare professionals with tangible things they can do to help when it comes to cancer. And while we know that not all cancers are preventable, there are things that we can all do that could make a positive difference to the health and well-being of our family, our friends and our colleagues. Now, Femi, we've come on the road for this episode, haven't we? We are not in our normal tower. Femi Oduwale, the MD of the Cancer Alliance. We've actually come to Maggie's Barts, haven't we, Femi?
We have, and it's lovely.
It's beautiful, isn't it? And but we're not alone. Our guest today is Victoria Curran, who is the centre head here at Maggie's Barts. Hello, Victoria.
Hi, thanks
How
for
are you
having
doing?
me. Good, thank you.
Thank you so much for having us. Femi and I were just saying before we started, a little bit embarrassingly, that we've not been to a Maggie Centre before, so this is all new to us. Bit embarrassing,
Indeed,
Femi.
it is quite embarrassing, actually. I didn't know you were going to put that on a podcast.
But I think it's good to perhaps take a little step back and start off with a bit of a history of Maggie's. What is it? How do we get here? And I guess who is Maggie as well?
Okay, so Maggie herself was a patient. She got diagnosed with breast cancer when she was 47. And then 5 years later, she got called into the hospital and told that he'd come back. So when that happened, as some of you may be aware, you then get moved into a corridor and sort of left and waiting for a nurse or the next person to have some conversations with you. And during that, it was sort of that dim NHS strip lighting kind of corridor. And they both thought that there needed to be something a bit better. And that's sort of where the blueprint of Maggie's and the idea of a Maggie Centre began. So Charles, Maggie's husband, was an architect. So they both had design backgrounds. They both knew the importance of beautiful buildings and how it can make people feel. So the biggest thing though, and as lots of people that will know that have had a diagnosis of cancer, is it doesn't just affect the person that gets the diagnosis. It can also be as difficult for the friends and family as well. And that's why Maggie saw a need for a different kind of cancer care. And that's what we do here at Maggie's.
When was that?
What is it?
When was that?
The first centre opened in 1996. So we've been going for just over 25 years. And as the charity has grown, we've built and developed more centres. So the first one happened and opened in Edinburgh, which is where Maggie was having her treatment. And since then, we've sort of tried to grow our presence across the country.
How many centres are there, do you know?
So we have 24 centres, but our hope is that we have one at every cancer hospital. That's what we're working towards.
It feels very innovative for 1996. It feels like we're still only really touching the sides when it comes to stuff outside of the conventional cancer treatment and how important that is. It feels amazing that they thought of, how the building looks and feels back in 1996.
Yeah, absolutely. And part of that is thinking about the space and how that makes people feel. So when somebody comes into a Maggie Centre, you may have felt that today, of it feels calm, it feels welcoming. And she knew that there needed to be a space where you can be more empowered and take control of your own, how you deal with cancer. And that's why we have our healthcare professionals within the team here to speak and spend time with people and really help them to think about how they live with cancer.
It's become really important, hasn't it? All the stuff we're going to talk about today, particularly the prehab that we want to talk about. What's your actual role here?
So my role as centre head is really thinking about the support that we offer within the centre. So I support my professional team, make sure that they're delivering the best care that we can to our visitors, but also to make sure that we're engaging with people such as the Alliance, with the hospital team on site, with community leaders, just to make sure that we're really bringing all the support in that we can. But the main part of my role is the support that we deliver. So to sit with people in the space, listen, and help them think about how we can support them and how they can support themselves going through their diagnosis.
So apart from the prehab, which we'll come to in a minute, what other services do you offer here?
So we offer lots of services. So we offer emotional, psychological and practical support within Maggie's. So that can be anything from somebody having money worries and coming into the centre and spending time with one of our benefits advisors. It could be somebody that's anxiety is very, very high, especially people that are newly diagnosed. All of those what if thoughts are coming through. It could then be joining a relaxation session, it could be on mindfulness, or it could be joining a course or a workshop such as managing stress. So very varied support, and we try and help that to be individual to what that person is showing us that they need.
Femi, we've talked a lot, haven't we, in the series so far about health inequalities, and it seems to me that a place like this is an amazing remedy for a lot of those health inequalities. We're talking about talking about your money worries, but also, this is a place for everybody, isn't it?
Yeah, absolutely.
I mean, it's that point around mindfulness. It's very current, it's very modern. We're thinking a lot more around how do we do things a little bit different. We know that actually having cancer is quite stressful. So having a centre like this is absolutely phenomenal, especially like you mentioned, it does have a sense of calm as soon as you walk into the building. And you've got the right tones of colours in the right places, feel comfortable, feel modern. It doesn't feel very clinical in terms of hospital setting. And
that's so true, isn't it? It doesn't feel clinical at all. I imagine it's a real break if you're getting hammered week in, week out with your treatment. You're getting fairly sick of going into a hospital every week.
Absolutely.
And you come in here and it's a complete different environment.
Yeah. And that's what we wanted. These spaces really are light, bright, but they're places that there's a lot of laughter. There's a lot of community, there's a lot of peer support, and that's what happens at Maggie's is people don't feel alone. You come and get that peer support, you meet someone over a cup of tea at the kitchen table, and it feels very different if you're having that conversation in the hospital. So the building works for us in many, many different ways, and it's that open door policy of anyone can come in. They don't just have to be having treatment here at Barts, it's for anybody.
What's your background, Victoria? Is it a clinical background?
Yes, so everyone within the team, all our cancer support specialists, all have clinical backgrounds. We've all worked in oncology in different areas. For myself, I'm a therapeutic radiographer. My previous job before this, I worked in Barts itself, and I was the breast advanced practitioner. And within that role, I saw the need of the conversations that happen for people during treatment, but also after. And it felt like a natural step to then come to Maggie's and be able to continue those conversations. After
treatment's a really important part of this whole story, isn't it? Because I think there's probably a perception for people outside of the cancer world. We all knew people who had cancer 10 years, 15 years ago, and we think maybe that's it, you're done, you skip out the door and on with your life again. But that's not the case, is it? And I think that's probably a part of the story that's maybe been overlooked a little bit. And not so much here, but more broadly.
Absolutely, and we try to fill that gap within Maggie's, and we know that the NHS are incredible at treating people when they need it, but what we've also seen the scope for is that people need us before they start that treatment, they need us during, and they need us after, and we've adapted our programme to be able to support people through that. Again, whether it's through courses, whether it's getting your fitness back up after treatment, and dealing with those long short-term side effects from treatment. You know, we know that we put people into early menopause. We know that they might have neuropathy, and what can we do to support you with that?
How many people do you get through the door kind of year in, year out?
So our centre here, we see about 100 people a day. So
Wow, 100 a day. How many of those 100 are patients, and how many maybe are people that were in my position? You know, you're the partner, you're the husband, you're the wife.
it can vary from day to day, but roughly about 50-50, depending on the day. But again, it just shows the need that people, you know, that are supporting someone going through cancer need us just as much sometimes as the person with the diagnosis.
Do you get people like that coming in by themselves without the person that's going through the treatment?
Sometimes they do, especially if somebody's an inpatient. Again, it's giving them that space away from the hospital to come and, you know, recharge and think about what they need at this time. But sometimes they come in together, you know, people newly diagnosed or about to start a treatment. They're spending the day together, you know, waiting for that appointment, because we often see people being supported. So they often can come together too. It's a real mixture.
I would have loved to have come in a place like this when I was, you know, when my first wife was going through a treatment. I guess I knew that it was there, but I can't really think why I didn't. But I think it would have been really, really, really useful. And I can imagine, you know, I used to hate going into hospitals. I just hated it. I hated every trip we went in. And it wasn't that the hospital, you know, there was nothing wrong with it. The people were amazing. Rachel's team were incredible, but I just hated it. I hated walking through the doors, knowing what was coming, knowing there was a test result coming. And I think I would have loved to have somewhere just to go, a totally different environment that would have taken me out of that place. And that's kind of the essence of this, isn't it, Femi?
Going back a little bit on a point that you mentioned, I can actually see, I mean, when we walked into the building, I just got to commend you all, actually. When we walked into the building, there was a very nice hello, smiles. Good. You do feel that warmness as soon as you walk in. So it's not only the building and the architecture, it's also the people, which I fit, the staff, shall I say, which is a great look for the NHS and Maggie's, but also you've got that warmth of what. So even if you walked in by accident, you'd be like, oh, what's this? You know. So, but yeah, I mean, you know, this is what the NHS needs. This is really, really important. And when I say the NHS, I'm talking working alongside the NHS. This is so crucial.
So let's talk about Prehab then. Again, something probably relatively recent, an understanding of just how your physical and your mental well-being is really important, both before your treatment and after your treatment. When did the Prehab stuff sort of start becoming a big thing at Maggie's? So
Prehab started before the one that we offered here at Barts. It happened up in Scotland a good while ago now. So that programme is quite well established. It's run across all the Scottish centres. And when we found out that it was an opportunity for us to offer it here at Barts, it was something that we obviously were very keen to take on.
What does it involve then for someone who's not heard of Prehab? Perhaps they're going through the treatment, they're starting the treatment in a few weeks. You know, what does it involve?
So the way that we phrase it here at Maggie's is we call it getting yourself ready for treatment, because that lands as something that you can, you know, it feels tangible. Prehab is quite a clinical term, so again, sort of making it into sort of a Maggie's thing of feeling more achievable and less scary. We call it getting yourself ready. And that can be, it's really about optimising your physical health, your emotional health, and thinking about how you can prepare yourself for starting treatment.
So what does it involve then? How do you actually get ready for treatment?
So we offer a workshop here. So it's a 90-minute workshop. And within that, we talk about emotional well-being. So within that, we'll give you some coping strategies. We talk about managing anxiety, thinking about those thoughts that can come up for people with a diagnosis, and giving them some tools that they're able to live alongside cancer a bit better. And we then focus in about nutrition. So just raising awareness for people about what does good nutrition look like? What steps can I take to look after my nutrition? And like anything, there's so much information out there. There's so many myths, and that can just feel so overwhelming for people. So we bring it down and just sort of really give them the facts and let people make their own choices. Nobody's going to be perfect, But we know that if you change one small thing, that's still helping yourself. And we do similar with the exercise. So again, just helping people think about what's your current fitness, what feels manageable for you. Could it just be a 5-minute walk every day if you're doing nothing? For those of you that are a bit more able, what could we add into that to be helping you?
That's what I was going to ask, actually, because it's not, we're not talking about, people need to become, triathletes, marathon runners overnight, are we? This is about making small changes that are going to make a big difference.
Absolutely. And sometimes when we're feeling overwhelmed, any change feels too much. So to come in and be supported with professionals that can help you with that, and think about what's important for you. What are you most worried about? And let's see what we can put into place to support you with that. And doing it alongside other people in a group session, you feel less alone. You have that connection, and that helps people hugely.
Femi, this is the kind of essence of this podcast, isn't it? Taking control of cancer. We don't, in a cancer story, in a cancer journey, there aren't very many things we can take control of, but this is one of them, isn't it? We can actually get ourselves in as good a shape as possible to go through, to cope with what's coming up.
Absolutely. I think people don't people forget that there is also the mindset has to be right, as well as you mentioned, the physical aspects of things as well. And actually, I remember I used to manage a service in one of my previous lives, which was the Centre of Pain Management. And I had an army of therapists that used to support to manage patients that have had surgery or preparing for surgery. And I remember some of the patients that had major back surgery, they would go to this centre first to try and see what type of therapy they can have. But I remember talking to some of the team members, and it's really the mindset that needs to be right. Some of this is just around managing pain or managing circumstances. It's just preparing for it. That preparation for it, that doing something different is just crucial.
How much is it on the mental side? I know prehab, perhaps people have thought it's going to do exercise classes like a spin class or whatever. How much of it is the mental preparation as well?
I'd say it's just as important. So I wouldn't say one's more important than the other, but I would say it's, again, sometimes people are already doing a lot for their emotional well-being. They might be accessing mindfulness. They might be doing yoga, which again is bringing the two together. So it's really just helping people find something that they can take action with. And while people are waiting, we often hear from them that that's the most difficult time. They just want to start treatment. They just want to get going. But Prehab offers you that opportunity to go into treatment knowing you're going to make an impact on your treatment. You're going to, your side effects might be better. Your outcomes could be improved. Your recovery time could be improved. And that then gives somebody something to work to and something that they can feel empowered when they've lost so much control.
That's massively important, isn't it? I can remember one of the most, for somebody looking on to a degree, I can remember feeling, I quite like to fix things. I think maybe that's a male thing. I don't know. We like to go in and we like to make things better and sort things out and fix things. And my dad was an engineer. This is where it comes from. But I can remember just feeling really helpless because I felt like there was nothing I could do to make the situation better. And we didn't do any prehab that I can remember, or we didn't do any. Well, there wasn't a post cancer for us, but there was no. I just don't remember ever, considering that. And I think it would have really helped my mindset, and I know it would have helped Rachel. But speaking from my point of view, would have massively helped me. Just feel like I was doing something, making a difference in some way in a situation where, I could make very little difference.
Yeah, absolutely. And we often see people, we have that workshop and it's open to partners, friends, family as well. So we know that if you've got somebody supporting you with change, that you're more likely to stick to it. And again, it's thinking about friends and family in these scenarios that, like you just mentioned, you're looking for something that you can help. You can't take away what's happening, but how can I support you? And something like this feels really, really, really helpful for people.
How do patients access these services then? Do they literally just walk in off the street is the I presume there's loads of signposting in the hospital. We're right next to here.
So we've tried to make it as easy as possible for people to come to us. So there's no need for a referral. You don't have to have treatment at this hospital. You can literally just come in. Come through the door. As Femi mentioned, hopefully you'll get a warm welcome and a smile. And somebody...
Great cup of coffee, by the way.
Great cup of coffee,
I forgot to
good.
mention the coffee.
Excellent coffee.
So that is what
milk.
we hope, with oat milk.
milk.
So we hope that that's what you get. You get that warm welcome, and you will get some time, come into the space, have some time with one of our team, and just think together about how we can support you. And whether that's a patient themselves, their friends, their family, or someone worried, somebody waiting on tests, somebody that's concerned, just come in and have a conversation.
I'm just sat here thinking, like, why didn't I ever come to a Maggie Centre? That's my main emotion here, because I just think it would have helped me so much, and I know that it would have helped Rachel. And we've talked, Rachel was treated at the Christie, and we talked before we started recording about the centre up at Manchester. And it's fantastic, isn't it? You were saying, and I just think, why didn't I go there? Because it would have been. Do you get any reluctance? I don't know if even if I'd have known about it, if I'd have gone. Is that kind of something? I don't know what I'm trying to say here, but is that something you encounter when maybe in a bit of reluctance to come here?
Absolutely. And again, it's that unknown.
Yeah.
What am I walking into? Who's going to meet me? What are they going to offer me? What are they going to talk to me about? People are in self-preservation mode sometimes as well, aren't you? You just, especially when they come to the hospital, it's I need to get in, I need to get this done, and I need to get out.
Yeah, that's exactly what it was, yeah.
And sometimes, as soon as somebody does come into a Maggie's, they normally always come back for something or the other. They know then it's a space that they're welcome in. And that's why we're trying to work with the hospital with different programs to bring people into Maggie's earlier and give people the option. It's nothing's perfect for everyone, but knowing you have a space on site, if you're waiting for chemo, there's a delay. Come and wait here with a cup of coffee. Your experience, you'll be calmer. You might have time if you wanted to have a conversation, that option's there. But if you just want to relax and use the space, that's okay too. So it's for people to know there's no pressure on you when you come to Maggie's. It's very much a space for you as you need it.
Do you ever have days where it's like you've got so many people in at the same time and you can't cope?
I wouldn't say we can't cope,
Okay.
But yes, the centre can be very busy. So you'll probably see after the recording today, the centre during the middle of the day is always much busier. People have had their bloods, they've come in for a group, they're waiting for their treatment. So it can be really busy, really, really busy. But that's never a negative. Somebody walks into that for the first time, actually the centre's full of life and there's people talking and it feels like a place that is welcome for everyone. So we have lovely volunteers who are incredible at making sure somebody gets that warm welcome if we're all in conversations. They get them a cup of tea or a coffee and get them a seat. And as soon as one of the team's free, we can come and spend some time. So if anyone ever comes in and it looks too busy, we're never too busy. Most people, when they first come in, will always sort of have a one-on-one conversation with one of the cancer support specialists usually. We then have one-to-one appointments available for our benefits advisors. We do have psychologists within our team as well, so they often run some of the courses and workshops and support groups, but they also do one-to-one support as well. So again, it's really just making sure that we're supporting people in the best way for them as they go through their treatments.
If you're listening and you're starting treatment soon, if you're in the middle of your treatment maybe, if you've just finished your treatment, what are some of the top tips that we can give people to get ready for or to make sure you're in the best shape possible, both mentally and physically?
So I think it's being kind to yourself is the number one thing I say to people when they come into the centre. We can often be our worst critics and think we should be doing things differently or coping differently. I often say to people, if your best friend was saying this to you, what would you say back? Give yourself some compassion. You're going through a very difficult time. Think about what it is that you need. It's an okay time to be selfish and think about what it is that you need from us, from your healthcare team, from your friends and family, and let people support you. People want to. You're not a burden. I think often people worry about not wanting to bring people down. You know, people don't always want to talk about cancer, and that's a really difficult place to be. And if you don't have that support, it's knowing that Maggies can support you, you know, and that's the important thing, is knowing that there is always a space for you and always time to come in and have those conversations.
Fabian, I don't know about you, but I'd quite like to work here.
I was going to say to Paul, could we just do all of our podcasts, all of our meetings and everything in here? It's a really, really nice feeling. And again, I think another thing as well to say is that actually I'll definitely ask that all, you know, kind of cancer managers, those involved with cancer, they need to pay a visit. I can say that now because I'm here. They need to definitely pay a visit. One, it just, when planning services, when finding other ways of working and making services better, I think, you know, a place like this is absolutely crucial. So it's interesting actually, because how do you also work with other charities as well?
So we do. Again, it's different across all the centres of what we have, but as you can see outside, all the information, we sort of pick all the best information that we can find for our people that come through the centre. So we work, you know, we have Breast Cancer Now's information, we have Macmillan's, Prostate Cancer UK. I run a support group with another charity, so it's really just making sure that we're bringing the best support to people. So we're very open to working with other charities as well, and there's lots of different things across Maggie's that happen like that.
Do you feel that there's quite a lot of promotion in hospitals in regards to the Maggie Centre, or is it just at Barts because you're close?
I think it's something that we're working on, is sort of making sure that other hospitals that don't have a Maggie Centre still have our information, because people are just as welcome to come. So that's definitely something. And again, it's about building those relationships. As you said, we often get new people that come in on then starting a new job, they're on rotation. Part of that is now come through Maggie's, come and meet the team, come and see what we can offer your patients and build that relationship. It's much easier, you know, having been I'm a healthcare professional. I know that when I signpost my patient, I want to know what I'm signposting to. So if people come into the centre, they're very welcome. It makes it feel much more genuine, and it really is then that endorsement of what we offer here.
Do you think people do actually know what's on offer here? The people that work in all the hospitals around here, do they know, you know, exactly what's on offer here?
I think some people do, some people don't. I think there's a mixed awareness across hospitals, healthcare professionals, but it's something that we're always working towards, you know, improving our reach. And that's the important thing, is that people know about us. And something I definitely see a lot of is when we say to people, oh, how did you find out about us? A lot of it is word of mouth. So somebody has used a Maggie Centre across anywhere, and they've said, if you've got a Maggie's, go and pop in.
You must absolutely love working here. I can sort of tell from your face that you just really love it. And it must be such a magical place to work. You know, so many difficult situations and people going through really tough times here. But, you know, what you guys are doing here is incredible. And just what a beautiful building to be in. Just, you know, you must feel so proud of what you do here.
Yeah, absolutely. I'm very proud to have my job and to work with the team that I do and to work within Maggie's. It was something that I've been doing for 4 years, and I've never looked back since joining. So, yeah, it's something that I've always enjoyed.
You're not going to head back into a hospital anytime soon?
I don't think so. I like the partnership. We get to do that partnership working, and we get to keep our hand in that way. But at the moment, I'm really enjoying this role.
Where does this go in the next 10 or 15 years? Because I imagine 10 or 15 years ago, if we were sat here having this conversation, we'd have been talking about a lot of very different programs, maybe a different, you know, way that you guys approach things. What are you kind of working on that's going to come in the future, or how do you see the role of Maggie's changing?
So I think our biggest want is that we obviously get Maggie Centres at every cancer hospital, you know, and just to make sure, as you mentioned earlier, that equity of access, that it's at every cancer hospital and it's an option for people. What we also are seeing, and it's happened in the last couple of years, is that when people are living longer with cancer and helping them live well with cancer, we have to think about those long-term side effects that some people are having. So we're already working on that development programme around the menopause support that we offer, androgen support. So we're already working on that, but we're also thinking about how can we support We don't always see as many men in the centre. As you said earlier, you're quite reluctant. How can we help? How can we help more men feel more welcome as well? So we're always looking at what we can do next.
How do you think you could make more men feel like it was somewhere they wanted to go? What's the thinking?
For me here, my thinking within this centre is thinking about what we offer within that programme. So are there specific men's groups that we need to be offering? Is it workshops? And listening to our community here and our population of what they'd like. So that's our development piece at the moment that we're doing.
It's hard, isn't it? Because I there's a sort of perception or a bit of a stereotype that maybe men don't like talking. I don't think that's the case. I think that we're just not very good at giving men the right environment and the right tools to do it. And I think when you do that, I mean, you find people just want to speak. You know, I get people contact me on Instagram who just, maybe their partner's passed away or something, and they just want someone to talk to, and they can't find that around them. They can't find a service around them, but they just want someone to speak to that understands. And I really think that's the case. That it's not that we don't want to talk. You know, we just need to find some way of being a bit more proactive with men, I think.
It sounds like a piece of work that we need to do jointly as a Cancer Alliance and Maggie's. And I mean, it's something, especially around awareness and just improving uptake. This is an uptake that we definitely need to improve, because actually it's crucial for that patient's pathway to have a space and a place to go to. So I think we definitely, there's a piece of work that we need to do around that.
That's where this podcast often goes. While we're talking, Femi's mind's working. Like, what can we do? How can we work together?
Absolutely.
What are you thinking, Femi? What are the big takeaways from what we've discussed today, do you think?
I think it's around promoting this the Maggies. I think it's so important, especially now that I can say that I'm here. Two, it's how can we work a lot more collaboratively. I know that we're already working on various different programs, but it's, what more can a Cancer Alliance and Maggie's do jointly? And it's also actually just ensuring, and I know I mentioned awareness earlier on, but it's ensuring that people actually understand the value, so that when they are planning services, they can take this service into consideration as well. Not that we're trying to overwhelm, but you've got the coping mechanisms in place from the sounds of it. But it's just ensuring, it's just so important, to be honest with you, especially when you take, like you mentioned, the physical, the practical, the psychological aspects into consideration. I mean, you are doing all three. You're catering for all three parts of what humans need, and offering that is such a human way of supporting people who are going through tough times or about to go through treatment.
Definitely true. Victoria, thank you so much for speaking to us. Thank you so much for inviting us here and showing us around. And yeah, it's been fantastic. Thank you.
Welcome. Thank you very much.
So we thought, Femi, before we left here, that it was really important to talk to someone who actually uses the centre. So I'm really delighted to say we're being joined now by Bridget McGrenahan. Hello, Bridget.
Hello, hi.
Thank you so much for coming to talk to us. This was a bit of a last-minute ask, so yeah, we do appreciate it. Just give us a little bit of background on your story and how you came to be using the centre here.
Well, I was diagnosed with breast cancer in October. And I had a very good friend who actually had been treated at Barts as well and had told me about Maggie's. So it must have been my first or second appointment. I came across with my sister and we had a lovely welcome when we came, because it is a bit daunting coming in because you think, oh, what's it going to be like? But actually somebody just smiled and said hello and then said, have you been here before? No, I haven't. So it started from there. And it was very just, tell us about yourself, have you heard Maggie's, that kind of thing, but very welcoming. Very.
What were your apprehensions about coming? Why was it daunting, do you think?
Because until you come in, you're not absolutely sure. I hadn't seen any literature about it or anything. I'd just been told that it was a good place to go and it was like getting a hug. And that's what it felt like, really. Did feel like getting a hug. And the big thing about Maggie's for me is that it's an opportunity to chat to other people who are going through the same journey. similar journeys, because obviously it's not all breast
Yeah.
cancer, there's other cancers as well. And that's really, really helpful for me anyway.
So what services did you or have you used since you've been here?
I've come to the workshop that's on the pre-treatment workshop, which was really good. Just getting yourself ready for it, especially the nutrition bit and the sort of exercise and things like that, where they went through, what might help. And a real element of that stuck in my mind was anxiety, how to deal with anxiety, which was really helpful. So I've done that. I've just come off the walk, because there's a walk every Wednesday around this part of London.
Oh, lovely. What's the walk? Tell us about the walk.
Well, it's led by a London guide. I mean, how great is that? And he really knows this area, because I've done 3 now and been on 3 very different walks that are an hour long and just really informative, just lovely. And again, you're with people who are going through the same journey as you, so it's a chance to chat about how they are and, anything that comes up, really.
So this podcast is all about how we can take control of certain elements of a cancer journey. And obviously there are certain parts where, it's out of our control, but there are elements that we can take control of. And it feels like this is one of the areas where, getting yourself into the right shape mentally and physically to deal with your treatment before and after your treatment is something that's really important for taking that control.
Definitely. I'd say before, during and after. I mean, I'm still in care, in treatment, and it's really important. It's a lovely place to just come, have a cup of coffee. If you don't feel like chatting to people, you don't have to. You can just sit. But if you do, and it seems very easy to open a conversation, people are very willing to chat to you and, say what's happening today. I mean, in between things like having a blood test done and then maybe having an appointment in the afternoon, it's nice just to pop into Maggie's, sit somewhere quiet. Lovely.
What does it mean to have, what's the difference between, spending time with people maybe in the non-cancer world and then coming into Maggie's and talking to people, as you said, people that are going through a similar experience, maybe understand a bit better. What's the difference in terms of how it impacts you or helps you?
I think perhaps there's more openness, because we all know that we're part of a big club, at different stages in that club. So there's more openness to talk directly straight about cancer than there would be, say, in a normal waiting room that's got lots of other people coming for lots of different things.
What would you say to someone either in your position or in my position where your partner or your other half or something is going through treatment or about to start treatment? Why has it made such a difference for you?
Because I suppose it's a centre specifically designed and run to help people going through a cancer journey. And that comes across almost straight away, from the lovely welcome, from the fact that it's quite low key, in that there's no name badges, there's no clocks, nothing like that. So that you can be at whatever stage you want to be, or how you feel yourself, to ease yourself into it. And I think at the beginning, perhaps it's important not to sort of over-stress things, but gradually people get into it and they realise it's not worrying, it's somewhere really nice. There's a warmth to it. And then they realise that actually there are all these other activities, a huge programme of things that they can get involved in or not if they want to.
How are you? I mean, what's your treatment situation at the moment?
I've had 8 sessions of chemotherapy, and then 2 weeks ago tomorrow I had surgery. So now I'm at the point of waiting for the outcome of biopsies, and then I'll know what the next part of my treatment plan is.
So we talked with Victoria earlier about the importance of this place in exactly that situation when you're waiting for scan results or biopsy results.
Yes.
This place becomes such an important place.
It does. And it's a great distraction, if nothing else. I went to art therapy on Monday for the first time. Now, that was
fantastic.
a little bit scary.
What was art therapy? Tell us about that.
Well, I thought, oh my God, am I going to have to draw something? Because I can't draw, I can't do anything. And it was just really lovely. I would say, and it's probably really not what it is at all, but it felt like a really lovely natter with art materials.
Yeah.
And it just is a distraction. And again, I would say on something like that, one of those sessions, you could say nothing and just carry on drawing or doodling or whatever.
Yeah.
Or you can say as much as you like, And there are people there who, some will be quiet, some will be chatty, and it's just lovely. The 2 hours flew by.
Do you sort of take out of it whatever
Yeah.
it is you need out of it?
Yes, exactly.
How did you hear about it?
Through a friend, first of all, who'd come and obviously got an awful lot out of it when she was having treatment. So she mentioned it to me very early on when I got my diagnosis. Be sure to go to Maggie's when you're at Barts. And then I was here with my sister and we just came along.
Because you mentioned it, you didn't see any leaflets or anything. So
No, I hadn't.
So it's usually
No.
so it's word of mouth. I think
Yeah.
when we were talking to Victoria earlier, she mentioned that it's just it's word of mouth. Really.
Word of mouth. Although there are leaflets around, they're certainly on wards 7A where you have your chemo.
What did your sister make of it?
Oh, she really loves it as well.
Yeah.
And it's, when the two of us come in, we just feel, right, we're here, we'll have a cup of coffee. And we always get a lovely welcome.
Yeah, well, we've had a great welcome and a great coffee. We were saying earlier.
Yes, good coffee.
It's fantastic coffee.
Good teas.
Yeah. Oh, it's a wonderful place. Bridget, thank you so much for coming and telling us your story.
You're welcome.